question of, just because you feel really good, why do I still need to come in and have chiropractic care? Well, the easiest way to explain this is using this chart. So this chart's called the road to recovery. We break care into 3 parts. The first phase is all relief. Okay, so when we start, we always start down here. The goal is to get to here. It's broken into 3 parts. So the first one is relief, which is from here to here. Okay, now this means that the reason why I like this chart is because it shows 3 possible outcomes that may happen when you first start chiropractic. The first one is, as you do the adjustments, especially if it's a very chronic problem, the problem may actually seem to get worse at the beginning. Okay, so that's what this shows. Okay, now the reason for this is because if the joint's very arthritic or very tight and very chronic, when we first do the adjustment, the first 1 or 2 adjustments, it may set off some inflammation. So that's why the patient may feel, oh, I'm actually really sore. But that's actually all part of the process of recovery. Now that's the first outcome that may happen. So this one. The second one is this one, where it's very steady. The patient may not seem to have any improvement, especially at the beginning, especially the first 2 or 3 adjustments, and then gradually the adjustment starts to improve. They start to notice it. The third one is straight from the start, the adjustments helps. Okay, so that's from here to here is all about symptomatic relief. That's the first step. Now, a lot of patients, when they get to here, when the symptoms are starting to go and they're feeling better, they're noticing improvements, they start to think, okay, I'm actually feeling much better now. Why do I need to come back? Well, that's what this, from this line to this line shows. This is more the corrective stage. Okay, so this is where the patient decides, do I want to keep going or do I want to stop? What I'll suggest is, if you stop, a lot of times what can happen is, because the underlying curvature, for example, is not corrected, only the symptomatic relief has happened. A lot of times, we give it time, give it a few months, the problem can come back and it can dip down. So you have a relapse. Now, the patient may then feel pain again, they want to come back. Okay, let's say, for example, they do that. They have 2 or 3 adjustments. It starts to feel better again. They have another 2 or 3 adjustments. It feels great. Then they stop. And then they stop for 2 or 3 months. Or maybe longer, maybe 6 months, maybe a year. Then they start to feel the problem again, down into here. So you can see what this happens. You can see this is more like, it's a downtrending. Okay, and so a lot of times you find that it comes and goes. So the patient gets really bad here, they feel better, they stop, they go back down. So it's a constant cycle. This is one way that patients approach chiropractic. What I'll suggest is do this one, which is more of maintenance care. Okay, more correcting the problems, especially curvature problems. And in doing that, it's more like a scheduled appointment. So for example, the schedule is more intense at the beginning and then gradually gets spread out. That's what this shows. You can start to see the spacing between each adjustment becomes longer and longer. And in doing that, you're actually entering more what we call wellness, maintenance. Okay? When you go with this, which a lot of patients do, but they learn over time that this is not the way to go, because a lot of times, even if they get really good here and they start to go back down, they're not feeling great again, they need a lot of adjustments just to get back to where they were, just to get back to how good they were at the beginning. And then it becomes a cycle. Okay, and in doing this process leads to degeneration. You have to remember every single time that the vertebra misaligns, as it misaligns down, it's going to stay stuck. Okay, it's only the adjustment that can bring that vertebra up. Okay, if it stays stuck like that, it's just going to stay in that position. It's going to stay in that position until it gets adjusted. So in doing that, it's going to lead to degeneration. Okay, so degeneration is the process of where the disc thins out. So rather than having a healthy disc, it can become like this. And every time that you decide to stop care, and just because you feel good, you don't even actually feel the misalignment in a lot of cases, because it's a slow build-up. It's not always trauma. It's usually a slow, gradual misalignments, bit by bit, and then gradually you start to feel it stiffening up. Then it starts to swell up. That's when you start to feel pain. So that's why I definitely recommend for patients who think about, okay, I'm gonna have a few adjustments, I'm gonna feel good, and I'm gonna stop. And that's usually what this indicates. So that's why I definitely prefer for patients to go in this more to the wellness side rather than just look at symptomatic care.